Hi, I am Dr. Biswa Mohan Biswal. I am a clinical oncologist in KPJ Ipoh Specialist Hospital. I am going to talk about cancer prevention. Cancer is the biggest challenge to the humanity. At the moment, the cancer rates are rising every year, and according to one of the statistics in year 2012, there are about 14 million new cancer patients, leading to 8.2 million deaths. If no cancer control programs is applied, maybe within these 2 decades, there will be about 70% increase in the new cancer cases. In Malaysia, the cancer statistics is fragmentary. However, every year we see around 30,000 to 40,000 new cancer cases. Cancer is a complex disease. It is not one disease, around a combination of around 200 diseases. And the management of cancer is also a combination of surgery, radiotherapy and chemotherapy. Applying all kind of modern technology of all armamentarium we have, we can cure only 1/3 of the cancers, whereas 1/3 of the cancer can be prevented. So I am going to focus on this prevention aspect of it. And cancer prevention is of 2 parts. One is risk prevention or primary prevention, and screening, those who to detect the early cancers. So coming to the primary prevention or risk reduction, we have 5 ways we can able to prevent cancer. The number 1 is the control of infection related cancers. Number 2, the control of lifestyle related cancer. Number 3 is the control of environmental related cancer. Number 4 is the smoking related cancer, and number 5 genetic related cancer. Infection related cancers is very important in developing country including Malaysia, and there are causes, infective causes which cause cancer, among them viral causes, bacterial causes and parasitic causes. The virus causes cancers are human papilloma virus, hepatitis B virus and HIV. So for human papilloma virus, we have vaccine which can control cancer cervix, and for hepatitis B virus which causes hepatocellular carcinoma, we have vaccine which is given to the newborn babies. And for HIV, we can protect from HIV, and for the bacterial causes of cancer, Helicobacter pylori is one of the bacteria which reside in the stomach, which causes peptic ulcer and also stomach cancer and type of lymphoma. By using appropriate antibiotics, we can control stomach cancer. Some of the parasitic disease, rare parasitic disease like Schistosoma hematobium cause bladder cancer, Clonicis sinensis cause liver cancer. So this cancer can be prevented by appropriate preventive measures. And coming to the lifestyle related cancer, this is the biggest threat to the developing world, including in Malaysia. And these cancers can be controlled by 3 major modalities, like control of weight, body weight, diet control and also physical activity. Diet is the major impact in 4 cancers, especially colorectal cancer, breast cancer, endometrial cancer and prostate cancer. So if you can improve the diet by using more fiber diet, more legumes and also fruits and vegetables, the incidence of colon cancer can be reduced. Coming to the obesity, obesity is one of the risk factor for breast cancer, and physical inactivity is also one of the risk factor for these 4 cancers. So my advice is that the people should go for physical exercise at least 30 minutes a day, 5 times a week, and this can reduce significantly this lifestyle related cancer. Alcohol is another risk factor for breast cancer, and also for specifically for breast cancer, those who marry late and they have first childbirth after the age of 28, those who do not practice breastfeeding are also risk factor for breast cancer. So this can be prevented by using all these preventive measures. In environmental related cancers, There is pollution is one of the important factor causing lung cancer, and also smoking, particularly passive smoking, and exposure to the industrial chemicals as well as asbestos. Asbestos is known to cause pleural mesothelioma. So, and also sun exposure, particularly if you are exposed to sunlight which contain the UVB radiation, this can give rise to skin cancer. It's very important in Australia, so that's why avoiding the sunshine from 10 a.m. to 4 p.m. and using the sunscreen of SPF more than 30 can prevent skin cancers. Coming to the smoking, which is very important for lung cancer, for cervical cancer, for bladder cancer, and this do not come only for the smokers. Those people who don't smoke also they get by passive smoking, and also children can get at home. And sometimes in the prayer room people use incense sticks. This could be also source of smoke which can cause cancer. Coming to the genetic, which has been blamed by many that it could be a cause of cancer, actually contribute only 5 to 10% of the cancers. So those people are born in a family with a history of breast cancer or colon cancers, they have some risk. Those who are having the blood or the test positive for BRCA1 and 2 genes positive, they have more prone for breast and ovarian cancers. This can be prevented by appropriate preventive measure like chemo prevention methods. By using tamoxifen can prevent breast cancer, can use aspirin and celecoxib in the risk group of those developing the colorectal cancer in the family, can prevent cancer.